In this lecture, we'll be discussing acute and chronic diarrhea. So some of these clues is that when the incubation period is less than 6 hours, it points to an infectious agent like Staph aureus or Bacillus cereus, which have preformed toxins. And when it is longer, say for 16 to 72 hours, then you can start thinking of norovirus or enterotoxigenic E. coli or Vibrio. In treating acute diarrhea, the aim of treatment is to reduce the infectious period and to prevent complication. So the specific treatment plans to do is to rehydrate the patient either orally or intravenously, depending on if the patient can take orally. Then you give antibiotics, you give anti-motility agents, but these anti-motility agents should be avoided if the patient is passing bloody stool. It will encourage the agent causing it. Others are anti-secretory agents and probiotics. The treatment is depending on the cause, and these agents that are used are listed here. For cholera, you can use doxycycline, azithromycin. Cholera is discussed in a separate lecture. For Campylobacter, you can use azithromycin, and as listed here, these are the agents used for different organisms. In prevention is directed towards the risk factors, such as provision of safe water, sanitation of the environment, personal hygiene, and then vaccine against rotavirus and other agents. In discussing chronic diarrhea, the better approach to chronic diarrhea is to classify them based on the nature of the stool as watery diarrhea, which can be subdivided into osmotic, secretory, and functional, fatty diarrhea, and inflammatory diarrhea. Each of these will be discussed with their causes. For watery diarrhea, the secretory and osmotic diarrhea are divided based on the fecal osmotic gap. And the fecal osmotic gap is calculated by 290 minus 2 into bracket the stool sodium plus stool potassium. And these are the causes. For secretory, the causes include alcoholism, infection, ileal bile acid malabsorption, and the rest. For osmotic, causes include carbohydrates, celiac disease, laxatives, and the rest. For functional, you have causes like irritable bowel disease, and the definition of irritable bowel disease is the presence of abdominal pain or discomfort on more than 3 occasions in the last 3 months, which is associated with any two of increased frequency of stool, increase the altered consistency of stool, or if the pain and discomfort is relieved by passage of stool. Fatty diarrhea is caused mainly by malabsorption of fat or carbohydrate, or as in celiac disease where there is gluten intolerance. Other causes are listed here. Inflammatory is mainly caused by conditions such as ischemic radiation colitis or malignancy, and it is characterized by elevated white blood cell count, occult or frank blood, or pus. Other causes are as listed. In evaluating chronic diarrhea, history must be taken, a thorough physical examination, routine laboratory tests, and stool sample analysis. In the history, these are some of the things to find out. And in physical examination, it is also important to find out signs of dehydration, to know if there's fever, so that one can hone it down to either infection or maybe a malignancy. And then it is important to find out signs of systemic diseases, such as skin changes, which can point to celiac disease, Addison's disease, glucagonoma, and the rest. The laboratory tests that might be done include a full blood count, which may show increased white blood cell, erythrocyte sedimentation rate, which might show inflammatory condition, serum electrolyte and urea, which might also point to some other causes. Then the stool characteristics might also point to the causes as listed here. If you have blood in stool, it might be a pointer to an enteric malignancy. If you have a watery stool, then you can say it's either osmotic or secretory. And the rest of the characteristics and what they point to are listed here. for your close observation. Then other things to do is to find the osmotic gap of the stool, which will help you classify as secretory or osmotic. Other things are as listed. The treatment of chronic diarrhea can be empiric while the underlying cause have not been determined, or once the underlying cause has been determined, then you give a specific treatment for the underlying cause. The indications for empiric treatment include, as an initial treatment, that is, before you even run a diagnostic test, you want to make sure you do something for the person. Also, maybe when you have run tests and then you can't find a diagnosis, then you just give empiric. Or if the cause you find does not have a specific treatment. So these empiric treatments include giving empiric antibiotic therapy, or you try pancreatic enzyme supplementation and conjugate bile acids if you feel the bile acid is deficient. Then you can give symptomatic treatment with opioids and loperamide. These are anti-motility. They reduce the motility rate such that the diarrhea reduces. And you can also use bulking agents, stool bulking agents such as psyllium. In conclusion, acute and chronic diarrhea are common conditions both in pediatric age group and in the adults. Acute diarrhea are caused by infectious agents mainly, and they last less than 2 weeks. For chronic diarrhea, the causes are wider and the cause should be investigated. In the absence of a specific cause, then empiric treatment can be given. Thank you for your attention. See you some other time. Bye.